Hi, my name is Eric Russ, and I graduated from King High School here in Tampa, Florida. I enrolled in B.E.S.T in the summer of 2020. I'm going into my sophomore year of high school. I'm so sorry, what was the second part of the question?
And then could you describe the experience?
Okay. Do you want me to redo the entire thing?
That's fine.
Okay. And how would you describe the experience?
Yeah.
Okay. So I entered B.E.S.T in the year of 2020, going into my sophomore year of high school. How I would describe the experience? I would describe it as very, in depth, a little hands-on. We had a lot of education on certain like anatomy, a lot of physiology, especially regarding the heart, and we also got to it was a lot of fun being able to do rotations in different departments of the hospital, being able to interact with different people who are involved in different specialties. I remember being able to see our hysterectomy. That was a lot of fun. And then being able to actually see a C-section, that was also a lot of fun. And just talking to some of the nurses, talking to some of the physicians, it was really enriching. And it gave me a larger perspective on how and if I want to approach being a physician in the future. So, some of the challenges I faced before the B.E.S.T program, I think is just generally having like a view of your future as a whole. So a lot of students in high school, they tend to think about sort of a vacuous view of pursuing medicine, but don't know specifically where that path is or how to approach that path. And so the B.E.S.T program, I got by getting to speak with physicians and people who are involved in the medical field already. I learned how I can, involve certain extracurricular activities into my application, or things that are going to be like helpful in the day-to-day as a physician, or what is important for the MCAT. Just a slew of different activities and an overall just general clarification on how I want to approach medicine and the path to that. And so that's what I'm currently doing at the University of Florida, pursuing medicine. I had the pleasure of being in the ICU, and I remember interacting with a patient who was on life support and was non-responsive. However, I was still able to interact with the patient. I was able to talk to them, even if they didn't respond. It kind of helped me put some more of the humanity into healthcare and kind of not forget that our patients are still humans at the end of the day. And so seeing someone at that condition, but still, making sure to provide them with some empathy, provide them with some form of bedside manner is just, it really showed the importance of that. I think some of the more pragmatic approaches I learned in the B.E.S.T program was, one, as a physician, you really have to know how to navigate certain situations, especially in the OR. So the B.E.S.T program gave a pretty grueling, if I'm not going to hammer on anatomy, especially with regards to the heart. And so as I work at the UF Department of Neurosurgery, and I'm doing surgery on mice, or if I'm looking at certain anatomical structures in mice, it is so important as a surgeon that you have the confidence to go in and make certain decisions on where you want to make incisions or where you want to snip tissue from, and that is incredibly important. And just knowing things, but having a strong background before you even interact with any organism is incredibly important. And then also, I think having just compassion for people as well. Working in Zephyr Hills, seeing a lot of the elderly patients, a lot of obese patients, a lot of people in chronic pain. It was just incredibly important to just be able to provide that that comfort and reassurance as a physician. So I'm currently pursuing my bachelor's in biology and pre-professional biology at the University of Florida. I plan to apply for med school within the next 2 years, and then after that, I'd love to do 4-year medical school and then do residency in neurosurgery would be the dream. I work with a lot of residents already, and so I kind of, have a scope of what that looks like already. So, yeah, that'd be the dream. 5 to 10 years from now, I see myself sadly still in residency, not yet, practicing by myself. So that's the goal. The B.E.S.T program, I remember we had someone who, we had a physician who had a colleague who was pursuing neurosurgery as well. And that colleague changed their mind on what they wanted to do. And they dropped out of medical school. And then that person had basically a completely different career change. And so I've tried to open my eyes to different specialties. I've tried to keep an open mind when it comes to practicing, how I want to practice, whether it's PA, whether it's dentistry, whether it's actually going to med school. And I think my heart's pretty settled on medical school. I think my heart's pretty settled on neurosurgery. However, I'm always open to change, but no, just having a diverse perspective of people who, maybe didn't want to do that, I think, just helped me keep my options open. One word I would use to describe the B.E.S.T program is very thorough. You get not only a comprehensive approach of anatomy, you get not only a comprehensive approach of the different roles of certain specialties in a hospital, but you also get the humanity approach of interacting with different physicians and seeing how they care for patients. It's very easy to know what a physician does, or what a nurse does, or what a PA does inside a hospital, but seeing them actually perform that job and the sort of nuance that goes into that job with making sure your patients have the highest level of care possible is probably just, it's an incomparable experience. Yeah. I am B.E.S.T.